A decade ago, we had a hunch that something was off with our child, but we shrugged it off as just the normal variances between kids, or perhaps a form of denial. However, when he reached 2 months old, we came to the realization that there was certainly some neurological issue at play. He was significantly behind on his developmental milestones overall. After consulting with several specialists for almost 3 years, we finally received the diagnosis through a genetic test at St. Louis Children's Hospital. Now everything makes sense. What is Sotos Syndrome? Sotos Syndrome is a genetic disorder that results in rapid physical growth during early childhood. Children with this condition usually have a larger body size, including a larger head, compared to their peers. Their facial features are often distinct, including a long and narrow face, a high forehead, reddened cheeks, and a small, pointed chin. About 95% of cases of Sotos syndrome occur due to new mutations rather than being inherited. The symptoms of Sotos syndrome can vary significantly. Individuals with this condition may have intellectual disabilities ranging from mild to severe, or they may have normal or above average intelligence. They may also experience global developmental delays, particularly in speech. Those with Sotos syndrome may also have other conditions, such as autism spectrum disorder, attention deficit hyperactivity disorder, phobias, obsession, and compulsions, tantrums, and impulsive behaviors. Although Sotos syndrome presents significant challenges, it is important to note that it is not a progressive or degenerative condition like many other neurological diseases. The good news is that with appropriate support and early diagnosis, those affected can experience improvement in their symptoms. In fact, many children with Sotos syndrome have the potential to lead completely functional and independent lives. Diagnosing Sotos syndrome involves assessing its clinical features and conducting genetic testing. If you suspect that a patient may have this condition, it is advisable to seek a thorough evaluation from a medical geneticist and pediatric neurologist. If you have any concerns or suspicions about your child's health, make sure to share them with healthcare providers. After all, you know your child better than anyone else. The rarity of this syndrome is partly due to the lack of knowledge amongst most providers, since if you are not aware of what you're looking for, you cannot find it. Despite the challenges, neither our son nor we have given up. On the contrary, we continue to fight so that he can reach his full potential. With the help of his therapists and teachers, he has managed to exceed expectations and continues to surprise us. His unique sense of humor and constant smile bring us endless joy and inspiration.